matter what name it goes by, its use in the treatment of patients in the United States is a debate that rages on today just as fervorously as it did 20 years ago. According to the Marijuana Policy Project, 2,604,079 patients are currently being treated by medical marijuana in the United States. Imagine the capability of one single plant to help in the treatment of cancer, AIDS, HIV, arthritis, even eating disorders. Now imagine that plant being held hostage by an outdated way of thinking and an expired political debate. This is the reality patients are now facing in the United States, Texas, and more states. My team, Team C, Jessica and Miriam, will discuss the pros and cons of medical marijuana, its use in treating patients, and whether or not Texas should adopt bills like 26 other states within the U.S. The use of marijuana as a medicine is remarkably uncontroversial at the bedside of a cancer patient or a child suffering from convulsions who might be helped. That was a statement by Dr. Steve Paterno, PhD, Deputy Director of the Duke Cancer Institute and Professor of Medicine at Duke University's School of Medicine. In today's presentation, we will cover the argument for the need of a medical marijuana bill in the state of Texas. Studies have shown that cannabis can be helped in the treatment of ailments. Over 26 states in the U.S. have allowed and passed laws so that patients may use any form of medication that they deem helpful in their ongoing treatment. Texas, unfortunately, while they have passed a bill, it's restrictive, non-inclusive, and lacks the actual help that these patients are seeking. There's a high probability that someone you know, maybe even yourself, will be inflicted by a debilitating and incurable, untreatable disease at some point in their life, whether it be cancer, arthritis, depression. Now imagine that patient not being able to receive the treatment that they desire, that their doctor recommends, and ultimately that they want. That's reality over 26 million Texans face currently with the Texas House law on the books. The use of medical marijuana has long been a topic of much controversy. Some studies have shown the results and the benefits of using marijuana for medical reasons far outweigh the effects that it may end up having on that patient, and therefore should be an accepted method of treatment for some patients who are suffering from illnesses such as multiple sclerosis, cancer, AIDS, even eating disorders. Former U.S. Surgeon General Jocelyn Elders once stated, "The evidence is overwhelming that marijuana can relieve certain types of pain, nausea, vomiting, and other symptoms caused by an illness, such as multiple sclerosis, cancer, and AIDS, or by the harsh drugs sometimes used to treat them. And it can do so with remarkable safety. Indeed, marijuana is less toxic than many of the drugs that physicians prescribe every day." ACP urges the review of marijuana's status as a Schedule I controlled substance and its reclassification into a more appropriate schedule given the scientific evidence regarding marijuana's safety and its efficiency in some clinical conditions. ACP strongly supports exemption from federal criminal prosecution civil liability, or professional sanctioning, such as loss of license or credentials. For physicians who prescribe, dispense medical marijuana in accordance with a state law. Similarly, ACP strongly urges protection from criminal or civil persecution for patients who use medical marijuana as permitted under state laws. The American College of Physicians. Today in Texas, both doctors and patients would face not only criminal prosecution, the doctors could lose their ability to practice medicine within the state. That means we have cancer patients who are seeking treatment from a doctor looking for a natural source of relief, and they're being denied this right because they don't meet the requirements by Texas state law as it stands. According to the FBI data, in 2012, over 75,000 people were arrested for simple possession. There is no doubt there's a high number of these that were using marijuana as a medicine in the treatment of an ailment. So how are Texans affected? Intractable epilepsy, the only condition covered under the current Texas law. 3, the number of licenses to be granted in the growth and cultivation of marijuana. Cancer, AIDS, arthritis, and PTSD are not covered currently under Texas law when it comes to marijuana use in the treatment of patients. So what that means is soldiers can fight for this country, can fight to protect the freedom Texans enjoy, even those drafting legislation, but they cannot receive marijuana as a treatment for the side effects suffered as a result of that war. Another huge problem with the program with its current guidelines is that doctors will be required to prescribe marijuana, but it's not clear that that can work at all since doctors are not allowed to prescribe marijuana. The act of actually writing out a prescription for cannabis. In states that have legalized medical marijuana, doctors simply recommend marijuana to patients. They do not prescribe it. So far in our presentation, we have shown there are calls from doctors and even former Surgeon Generals of the United States calling for the ability of patients and practitioners to use marijuana as a medicine. But we have also covered that the fact that in Texas the current law is not only flawed in its delivery, it is also flawed that only one condition is currently covered in that bill. So thousands of Texans are without a legal option to naturally treat their ailments. It's important for the discussion to be had by not only the position of legalization, of availability, by these politicians in the state house, but the voters must stand up and speak out on how they see doctors being able to treat their patients.